The following is a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good evening. It's Gil Lederman. We hope you're all well and had a great weekend and relaxing and listening to the show and hopefully learning things that you otherwise might not have known about. Healthcare is filled with a lot of secrets that may change or save your life or your loved one's life. My name is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center at 38th and Broadway, but more about that in a few minutes. I wanted to talk about news of the day, actually. We try to always have news that's relevant to you, and there was an editorial in today's New York Times that's really relevant, and not that I necessarily agree with the New York Times. I probably disagree more, but the issue is antibiotic resistance, and I have been warning people since medical school, so more than 35 years, since learning that endless antibiotics can harm people. And I have friends, I'm sure you all have friends, and some of you may have taken antibiotics yourself, seemingly more than would be prudent. I have a friend who must take antibiotics every other week. In the 52 weeks a year, she probably takes 25 courses of antibiotics, Z-Pax and erythromycin and ampicillin and amoxicillin and you name it, and she's got it. And I always warn her about the possibility of superinfection, and it's really getting to be more than a possibility. Anyway, the editorial in today's New York Times quoted the World Health Organization, which has surveyed the growth of antibiotic-resistant germs around the world, and came up with disturbing findings, the Times report, saying that antibiotic resistance in bacteria, fungus, viruses, parasites is an increasing threat in every part of the world. It's so serious that it threatens the achievements of modern medicine. A post-antibiotic era in which common infections and minor injuries can kill, far from being a fantasy, is a very real possibility for the 21st century. End of quote, New York Times. And I can tell you that I have patients, I get patients from around the world. I have patients, one man I saw, a very famous judge in New York. He went to a big cancer hospital here. He had a little tumor on his buttock. It was a short operation. He recovered. The next day he was due to go home, got a fever, got infection in that buttock. He ended up hospitalized for 2 months and then in a rehab facility for 6 months. He walked in the hospital, and that was the last time he walked on his own. By the time he recovered from the infection, which took 6 months, and the complications, the cancer grew back. So not only did the operation do no good, but the antibiotics almost did no good. He never recovered. He never got back on his feet. And it's what I often warn people to stay off antibiotics. If you can stay out of a hospital, stay out of that hospital. That's why we're so happy to be in an outpatient private cancer treatment center. There's no ICU, there's no resistant bugs and bacteria and fungus percolating in our place. You come in, you go home, and that's it. When you have sick people in a hospital, even sometimes well people in a hospital with super bacteria, you have a high likelihood of contracting that terrible infection. And about 10% of the people that get infections in the hospital actually die of those infections. So it's not just taking some antibiotics and going home. These are infections that cause tremendous severity of sickness, ending up in the intensive care unit, and 10% of people die. So the warning is, if you can stay off of antibiotics, please do so. If you have a doctor who sees you and you say, oh, I need an antibiotic prescription, I got a sore throat or a cough or a muscle ache, and he or she gives it to you, it's probably the wrong doctor. So you should get someone that's a little more prudent, because even antibiotics, even something so simple as antibiotics, which are really very powerful medicines, can be abused. They can harm you. They can cause super infections and even death. So it's the warning of the day, and I would urge you all to read the editorial that's in the New York Times today. They said the most urgent need is to minimize the overuse of antibiotics in medicine and agriculture. And a lot of us are getting antibiotics in the food we eat. The cows are given antibiotics, tons of antibiotics, to make them get fatter. And maybe we're all getting fatter because of all the antibiotics that are in the food supply. Farmers are giving the cows antibiotics to make them grow bigger. They get more money. They get paid by the pound. The bigger the cow, the more they get paid. They give them these antibiotics, and they stay in the food chain. So if they're doing it to cows, maybe they're doing it to us too. So sometimes we're getting these antibiotics even where we don't want them. So I just urge a word of caution. Look at this editorial. As they concluded, antibiotics have transformed medicine and saved countless lives for the past 7 decades. Now, rampant overuse and the lack of new drugs in the pipeline threatens to undermine their effectiveness. So that's the new news tonight. And I want to go on and talk about cancer. We're live, so if you have a question, please call us at 800-321-0710. We have Noah and Ed here taking your calls. They're the experts at WOR. They're running this place tonight. It's all on their shoulders, so you can call them, and they'll put the call right to me at 1-800-321-0710. We're happy to take your questions and concern. One of the first patients I want to talk about tonight is a man who came in Friday, 57-year-old man who from New Jersey, and all of a sudden in 2008, his life changed. Everything changed. Gained weight, developed diabetes, high blood pressure, had no libido, no erections, abnormal thyroid function, and what was causing all of this? A large pituitary tumor. So that pituitary tumor that's deep in your head, behind your eyes, behind your nose, deep in your head, controls many of those functions. And this man has been in a tizzy for 6 years, never feeling the same. He's got a large mass. He was seen by 3 neurosurgeons. The patient declined neurosurgery because he thought that the neurosurgeons would leave him less healthy, that they would destroy any residual function of the pituitary gland. His most recent MRI was in November, and he had blood tests in April. And again, his main symptoms were no erections, no libido, poor vision, decreased visual fields. He's 5'5", 219 pounds, and this big tumor that's compressing the chiasm, cavernous sinus, extending to the prepontine cistern. So we've actually recently reviewed our data over about 20 years for the treatment of pituitary tumors, and the vast majority of patients we've treated have been successfully treated. Success means stopping, shrinking that tumor, the pituitary tumor. The pituitary tumor is a benign tumor. We treat a lot of benign tumors in the head. Acoustic neuromas, meningiomas are among the other benign tumors we treat. We treat also cancerous tumors. We were the first in New York to treat with brain radiosurgery, which means we can focus in and treat the tumor while avoiding the dose to the healthy brain. So prior to that time, the healthy brain got the same dose as the tumor area. We can give the tumor area the dose and avoid that kind of dose to the healthy tissue. Our treatment also, unlike gamma knife style treatment, has no helmet or screws that screw into the skull through the scalp. So our treatment is a painless treatment, outpatient treatment like I talked about before, and highly successful. So for this man, he heard about our technology and our experience, and I think he was impressed with it. I'm certainly proud of our data and proud that we can present our data at national and international meetings to show state-of-the-art technology. And we had another patient who came in. This is a man who was a 65-year-old lawyer, single man, no children. A year ago, he had esophageal cancer diagnosed. He had trouble swallowing and had tests done. Went to 2 big hospitals. Since that time, he had chemoradiation surgery. Since that time, he had surgery. And actually, he's a second patient last week who had surgery, and the cancer came back right where the surgeon manipulated and cut his esophagus. In both cases, they had chemoradiation and then surgery. The surgeon cut out the cancer area, and the cancer came rip-roaring back right in that same area, which makes you think that the surgeon might have been contaminating the area with his surgery. In the first case, actually, the pathology in the esophagus showed there was no cancer, but the cancer came rip-roaring back right where the surgeon had his hands. So now the patient comes to us with cancer in the paratracheal area, that's by the airway on the right side, in the liver and the sacrum. The sacrum is a tailbone. It's right the area where you sit. The liver you know about. So there's about 4 areas. And the doctors at this famous hospital are giving him the same drug he had a year ago. Well, gosh, if it didn't do the job a year ago, what's the likelihood it's going to do the job today? Chemotherapy is like antibiotics, which we just spoke about a few minutes ago. If the cancer cells have already seen the chemotherapy, they're probably already learning or have learned how to resist that chemotherapy. And the doctor said he's only going to give him a little amount, and it's not going to hurt him. Well, it probably is not going to hurt the cancer either. So we spoke to him about stereotactic body radiosurgery, a treatment that we pioneered. And we can certainly treat any area in the body by the trachea, the liver, the sacrum, and our success rate for esophageal cancer, where we aim the beam, no matter where it is, if it's in the paratracheal, lymph nodes, liver, sacrum, or elsewhere, it's over 90% for the rest of the life of the patient with cessation of growth, shrinkage, or disappearance of the cancer. So for this man, he knows our data. He knows what I think about it. We don't tell people what to do. Patients are smart, and patients hear the options. The patient is like the President of the United States. He gets to hear the option, makes a decision, and chooses the doctor just like the President of the United States chooses his advisor. So that's how we think medicine should be practiced. We work for the patient, not the drug companies, which also makes us very different than a lot of hospitals, which take tens of millions of dollars from the drug companies. We don't take 1 penny from anybody. We work for the patient. And isn't that what you want? No secret hands of manipulation. You know exactly what's going on with us. Now, lucky, we're going to get to hear 2 new voices, and they're great people with great voices, and they're going to talk about radiosurgery in New York. And while they do, you should listen. And you might want to call us. We're live at WOR Studio, 1-800-321-0710.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting cancer, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare and Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radio Surgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radio Surgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're back talking about new people and new cases and how we can learn what's going on in New York and what's going on in the world and what's going on with each human being. We had one gentleman who came in, a 63